I'm Dr. Jeff Waldron. Today I'm going to talk about a reverse total shoulder replacement. There's a couple things to consider if you have an arthritic shoulder and you're considering that this is something that you want to do soon or you already have one scheduled. They're not quite as common as total knee replacements or total hips, but they're still a very successful surgery. So in this video, I'm going to talk about what a reverse total shoulder is, some exercise you want to consider before you have the surgery to get ready for it, and then I'm also going to talk about the first 10 weeks especially, because there's certain precautions you need to take around each week to make sure you have a successful surgical outcome. What is a reverse total shoulder? This is a very successful surgery, similar to total knees and hips, but the thing that's different about this surgery is that they're going to change the orientation of the joint. So usually you have a ball sitting in the socket, so the socket is concave and the ball of the humerus is convex, and it moves as so in the joint. But with reverse total shoulder, they change the orientation to increase stability of the shoulder, and they change the socket to the ball, and then they change the shaft section here to be more of the socket. And they do this for a couple different reasons. They need to release the Subscapularis Muscle tendon, which creates a lot of stability here to get access to do this, and then tighten it back down and cinch that in. So we'll have to be careful that you don't have any dislocations after surgery. And the other thing, that's another risk with this surgery is that you do not want to get an infection. So there's a couple things we'll need to consider around that. But otherwise, this is a very successful procedure. A lot of times your surgeon will have your anesthesiologist do an interscalene block here to the nerves to reduce pain for the first couple days after surgery. So that's something you can ask if that's part of their normal practice, depending on the approach that they take to access the front of the shoulder. So I alluded to earlier that two of the main risk factors of this procedure are infection and dislocation of the shoulder. To reduce that risk, your surgeon's going to do a lot of things, having a very sterile operating room that will minimize that. But I often tell people you could get a scrub at home where you scrub and clean your skin and make sure it's nice and clean the night before. And then just simple things like washing your sheets the night before. Make sure you sleep in nice clean sheets so that you're going into that operating room the next day not having anything on your skin that possibly that's part of your normal flora that could cause an infection. So doing a little bit of those couple small things can help reduce your risk of infection. The other thing that is a risk factor is dislocation of the shoulder. We minimize that with some of the exercises and precautions I talk about after the surgery with your surgeon putting you in a sling for the first 3 to 4 weeks. They'll also talk about limiting how much you move your arm out away from your body and doing rotation. So we're going to minimize this external rotation, internal rotation, especially with the elbow away from the body for the first 4 to 6 weeks. One of the issues, sometimes people are going in and trying to tuck in a shirt behind their back, or they get their elbow behind their body too far. That's sometimes a little risky early on, and you'll want to be careful the first 4 weeks that you're not doing too much behind the back or any behind the back so that you don't dislocate your shoulder forward out of the joint. So we'll discuss that, and I think it's really important that you schedule with a physical therapist and you're getting a lot of guidance around what your surgeon's protocols are and following their instructions, keeping that wound nice and clean and healing, and then making sure you're icing your shoulder 3 to 5 times a day for 15 to 20 minutes. You want to take that ice pack off occasionally and check your skin and make sure that you're not causing any irritation on the skin. But if you do some of these things and consider some of these things, you're going to have a much better outcome post-op with your surgery, and you're going to be doing pretty good at 6 months. But really, this type of procedure, you're going to have a whole year of full recovery with it. So you want to keep that in mind and have your expectations set correctly. So now I'm going to talk about some of the exercises that you should do prior to surgery. So it's important you remember these are before surgery, and your goal is to try and get as much range of motion as you can and get some good deltoid and periscapular, so these small muscles nice and strong before surgery. You do not want to overdo it with exercises and overly irritate it before you have the surgery, Your surgeon's not going to like going in there with a very inflamed and mad shoulder, so just be gentle with some of these and do what you can and get what's available, but not overdo it. So a couple of things that I'm going to go through. I'm going to go through a few different options depending on what you have at home. You may want to order a couple things. Most of this you can do pretty inexpensively and not spend any money and use stuff you have in the house. So you're going to want to work on your shoulder flexion going overhead. So you can kind of work your arms like this. You can use a cane, or you can use a broomstick or something in your house to work your flexion. You could also lie down on your back and you could do some exercises allowing gravity to assist, getting your shoulder range of motion back and forth. You can do 15, 20 of these, just going to where you feel comfortable. You can do some pushing up and down this way, working a little bit of your shoulder mobility. So that's pretty helpful to have the cane and stick or a broomstick, which is pretty easy to use. The other thing you want to think about doing is getting your cuff a little stronger going out to the side. So I like to use a hand towel, fold it up and put it just underneath the elbow so that you're not moving too far like this, and you can stand and just hold one end, or you can put it in a door and you can block down on your shoulder like so and just start working your rotator cuff with nice small movements. Most people tend to rock their shoulder forward, and so it's important that you set your shoulder blade back and have a nice posture and then gently work small range. I don't need you to go really far out. That's not as important as just turning on those muscles and working the quality of movement. If you don't have a band and you want to use a hand weight, this is a 3 pound. You could use a soup can if your shoulder is particularly weak, and you could just lie on your side so you're going against gravity. Put the towel here again, and then you can just kind of work that arm up and down in a small motion just to turn on that rotator cuff and some of these muscles out to the side. I tend not to have people do a lot of weight training raising up when they have an arthritic shoulder, because sometimes they're banging into this outer bone in the shoulder called the acromion, and that can sometimes cause a stress fracture, a lot of irritation there. So we do want a lot of good deltoid function here and rotator cuff function, but just do what you can without over irritating the shoulder, working your cuff a little bit, and the main thing is get your range of motion. It'll be much easier to get your range of motion after surgery if you have pretty good range ahead of time. 2 more planes that are important are getting behind your back and reaching up. So you can go ahead and grab a towel like so and pull up and back, so you're kind of working across. If your shoulder is very arthritic and you can't go that high, you can work this way and start working across the body. Sometimes I'll have people go ahead and grab like a door handle here, and they can walk across and work their shoulder mobility this way. If they feel uncomfortable and it's too painful to move, you can just grab something and then sidestep across to get your shoulder rotation. That'll be the same thing, and it might be a little more comfortable and less irritating. The last thing, I find a lot of people can't get into a door frame and stretch their rotation back because they might have a painful shoulder. So I like to have people sit down next to a dining room table or something, set their hand on the table so this is face down, and then keeping your neck nice and straight, you can bend forward, bowing at the waist, and that essentially brings the arm back the same way. So you can work your range this way and coming back and forth. If it's painful, bending forward like that, you could always sit at the table and slide forward and work your range of motion in this direction. The next thing I'm going to go over though is going to be how to use a pulley system. A lot of times you can order these for $10 to $20 online, and it's a good idea. You're going to use it quite a bit, so I encourage people to maybe have one of these set at home. For the door pulley system, you just set it up over your door. You can close it in a little hook in the door. You can order these online. They have handles, simple rope. And the main thing you're going to be doing with this is working your shoulder mobility. So let's say I have surgery on my right shoulder. I'll be using my left hand to assist, because a lot of your movements, we're not going to want them as active a range of motion initially, and you're going to need that assistance from the other side. This is still something pretty far out, several weeks after surgery that you'll do this, more like 5 to 6 weeks. But this one right now, you can do this before surgery, work your shoulder in the front plane, you can work your shoulder out to the side and do a little bit of abduction, and you can work it slightly forward halfway between those two and this direction, working that shoulder up and down. So this is a really nice tool. You can do 5 minutes a day, just get that joint lubricated, a little synovial fluid in there, and help that joint get used to moving in that plane with minimal pain. So just go to where you can without jamming into lots of pain. You just want to go where you comfortably can. Make sure you're not shrugging and doing this with your neck and substituting. You want to keep the shoulder down. So it's really important as you do this, you work on dropping that shoulder down and getting quality movement through the shoulder without this big hiking substitution. So the first 4 weeks after surgery, you should be scheduled with a physical therapist, have the protocol that your surgeon wants you to follow. Depending on how your operation went and the quality of the tissue will depend on how aggressive their protocol is, and they'll probably talk to your physical therapist or send notes on what they want done. So you should really be getting skilled intervention at this time. When you're sent home, the first couple weeks, you're trying to heal. You're icing several times a day, 15 to 20 minutes, 3 to 5 times a day, regulating your pain. You're going to be doing a pretty simple exercise called a pendulum, where you're putting your hand on a countertop or a solid surface, letting your surgical arm dangle, and then you're going to use your legs to do little circles or front to back and side to side. The thing I see people do wrong is they come in and there's no hip motion, and so they're just doing this, moving their arm. That is not passive range of motion. The movement all needs to come from your trunk and not from the arm. So this just really dangles like a pendulum. That's why it's called a pendulum exercise. So you move and let that arm rock. I know this is difficult for all the non-dancers out there to find movement through your hips, but you need to practice and get this one down so that your arm can swing gently, is gently in traction, is not actively moving or breaking any of the precautions from your surgeon, and you're nice and safe in that position. You're going to want to make sure you keep that wound clean and not get anything in there, and follow their instructions. And you're going to want to keep it dry. The first couple weeks, that incision is healing, and you want to keep it nice and dry. You also, that first 4 weeks, you're not going to soak in a bathtub or jacuzzi or anything like that. You're going to really need to keep that dry and follow your surgeon's recommendations for care for that shoulder. And then your physical therapist is going to help start guiding you through that first 4 weeks. Is when you're going to start beginning some of your exercises. Depending on your surgeon, you may have started some isometric exercises where you're pushing gently. I tend not to start these week 5. It tends to make patients really sore and irritated. So I tend to get them going with some things to minimize scar tissue and improve joint health, and just settle down some of the muscles. So the big ones are, you'll start week 5 gently using the pulleys like I showed for the exercises pre-surgery. So you can sit down and work in the front plane here and out to the side slightly, just all that stuff that's minimal pain, nothing too aggressive. You're going to start using your cane, typically lying down on your back. If you can tolerate this, you lie on your back, and you may only get to here, maybe 90 degrees or so, 120 degrees, just going where you can. Sometimes people can't go all the way down, that tends to hurt, so they just work the upper range, 10 to 12 reps. Listen to your body, follow instructions of your physical therapist. The big thing during that first 5 weeks is most surgeons want you only to go 20 degrees out to the side, and this is with your elbow at your side. So it's really important. That's like 20 degrees. So if this is 90, here's 45, there's 20. So you're not moving that arm very far away from your body at this point. Usually by week 5, you've discontinued use of your sling unless you're out in the community in a crowded area. But most people have stopped using the sling at this point unless their surgeon wants them to sleep with it on the first 4 to 6 weeks. But usually by week 5, you've discontinued that. And you've began some of these exercises with your physical therapist and you're getting some assistance and guidance with. Week 6, and these are all rough and it will depend on how your healing is going. Usually you can start to work your shoulder out to 45. So again, here's 90, 45's halfway between front and there. So you can start working gently with your arm at your side, 45 degrees of external rotation. We're being careful because they detached that subscapularis to do the surgery and have reattached it, so we're letting that heal and we're minimizing risk of dislocation. So week 6, we're gently starting to work towards that 45 degrees of external rotation. We may begin to work on a little behind the back. So we may be doing a little bit of this kind of thing, working some gentle internal rotation. If you're moving further along and you can keep that elbow in here close to the body, you may be starting to work up a little bit. Your physical therapist will probably have you start doing what are called isometrics, where you just hold that elbow at your side and you gently push into the wall for 5 to 10 seconds. This is really light. So if you're really pushing hard and firing up your shoulder and making it mad, you're going to be sore for 3 to 7 days. So just go really light, push gently. So you'll go forward like you're punching, elbow at your side. You'll go out to the side. So I'm pushing out this way, 5 to 10 seconds, maybe 10 reps. You'll go in, just kind of gently turning on those muscles, getting them to set. You don't want to do these with poor posture. You want to be nice and upright. And then the last one is pushing back. Sometimes we do this against a wall, and then you're pushing into the wall gently with this good posture, just getting those muscles set and turned on. And by turning on those muscles, what you're doing is you're really protecting that whole entire cuff, getting all these muscles that would look like my fingers engaged on that shoulder and getting it nice and stable. So you should be doing some of those types of things around week 6. It's week 8, and now you can begin working towards 60 degrees of external rotation. So you were at 45, now you can go a little further, pushing it and assisting it with a cane. Now we're starting to go out 60 degrees gently, not forcing it. Should be relatively pain-free, just kind of a gentle pull, working that back and forth lightly, getting guidance from the physical therapist that you're seeing. You're also at week 8, going to start with pretty lightweight, maybe 1 pound, really light tubing, and you're going to begin some of your resistive exercises of your shoulder, doing some things to activate and strengthen your shoulder. So you'll get guidance with that with your PT that you're having to begin a little bit of strengthening, going past these isometrics and into some gentle resistive exercises, still minding that protocol of not going past 60 degrees into external rotation. Week 10, you're progressing your exercises, getting your deltoid stronger at this point, starting to have pretty good function, being able to do most of your activities. There shouldn't be too many limitations at week 10 that you can do with your shoulder. Of course, that depends on how your recoveries went and the guidance and everything you've had with your physical therapist and what your surgeons want with your care team. I hope you've gotten to this point and you're feeling good and really happy with your decision of having this replacement. And I hope some of these instructions in this video were helpful for you to know what to expect and the length of time and how involved it is for this procedure. It's a very successful procedure when it's done correctly and you have your best possible team surrounding you and guiding you through this. And some things that I want you just to remember is that you just make sure you ice when you need to. You're going to be a little uncomfortable laying down initially the first couple weeks, and you may need to sleep in a recliner or do some things to kind of protect that shoulder using the sling. But be careful and mind the instructions and get your home prepared and ready for this procedure, and you get the appropriate assistance around you while you're having this done. So hopefully you found this video helpful, and if you did, please share the video